Dr. Zaheer Shah is a primary care physician and he joins us from Arizona. Thank you very much for coming onto the programme. What do you make of the saga of the past few days?
Well, it's been a bit like reading tea leaves because I'm not sure that any of us outside of the inner circle in the White House actually has the full understanding of what's happened to President Trump. I can tell you that the medical care that he's received has certainly raised eyebrows. The fact that he's gotten the monoclonal antibody infusion, which is experimental and would not be eligible, no one else in America really, realistically, would be eligible for that outside of a clinical trial. The fact that he's getting the 5-day course of remdesivir, both of those two interventions made sense to me because in the first week, the primary goal is to lower the viral load. That's the number of virus that are found within the infected host. But then something startling happened, which is that they also began dexamethasone therapy. Now, dexamethasone, so early in the course of COVID-19, is highly unusual and doesn't show any clinical benefit in the trials that have been done to date. It's really more of a treatment used for those that have more advanced disease, generally in the second week of the infection, where they've either ended up on a ventilator getting mechanical support for their breathing or are at least requiring oxygen and or even BiPAP. And the fact that it started it so early tells me that he's perhaps sicker than we know. And keep in mind that any patient, any human being that's put on steroids is not going to have a fever as likely, is not going to have a lot of the aches and pains associated with something. And generally, whenever I prescribe steroids for a patient for a variety of conditions, they'll come back telling me how great they feel, how their joints don't hurt anymore. So it's difficult to gauge how much of what we're seeing in him walking around, giving the thumbs up, is actually due to the fact that he's on a fairly substantial amount of steroids versus an actual and genuine recovery from the underlying infection.
And if his condition is worse, as you suggest, than we've been told by the officials and Trump himself, does that mean he's likely to have defied the doctor's advice?
Well, his track record is to minimize, if not altogether dismiss, good medical advice. He is now claiming that he's learned deep and valuable lessons from his experience as having now been infected with it. One of the doctors involved in his care, I think in the second press conference, I think stated correctly that he is receiving state of the science care, which means that when President Trump got COVID-19, he certainly didn't get hydroxychloroquine. He didn't get azithromycin. He certainly didn't get Clorox or any of the other things that he had recommended that other people receive. Instead, our president got Regeneron antibody infusions, which are only available in experimental trials, but clearly are, I think, potent ways to reduce viral burden, viral load. He's also gotten the remdesivir, which is an antiviral agent that has shown some efficacy, particularly if it's implemented early in the course of the disease. And then, I think the dexamethasone that he's received may make him feel that he's doing better than he actually is. If you listen carefully to the press conference today, his personal physician, Dr. Conley, said that, we're not ready to breathe that final sigh of relief. And I think he's tipping his hat a little bit there and his hand because we all know that sometimes in patients that are doing remarkably well during the first 7 to 10 days of infection, suddenly have a decompensation at that 7-day to 10-day mark. And so I think in some ways we have to wait to see what happens. And I certainly hope that for a change, President Trump adopts what is consensus medical opinion because, this science has to trump his political opinions.
Now, if he hasn't fully recovered within that 7-day period, will he be in a worse condition for having left the hospital early?
Well, that's a very interesting question. And I think if he was an ordinary citizen, we could certainly make that argument compellingly. But keep in mind that the White House has what they call the White House Medical Unit, which is staffed by up to 8 physicians and basically can serve as a level 1 trauma center It has the capabilities of doing a lot of things that most ordinary homes don't. So, yes, President Trump, for the sake of a photo opportunity, has been transported from Walter Reed to the White House. But as soon as he goes inside that White House, he's going to be tended to by a full arsenal of healthcare and healthcare professionals that make the determination of, well, did he go home too early, I think completely useless, because for all we know, he's getting IV infusions in the basement of the White House as we speak.
Dr. Zaheer Shah, thank you very much indeed for joining us.